The whole Providence system is across 7 states and offers a very comprehensive set of services. We have long been focused as part of our mission and core values on serving the poor and vulnerable in our populations, which means we want to provide services to all members of our community. Certain social determinants of health can really impact how patients do at managing their diabetes. And so by connecting with our partners in the communities, we can really help impact and manage those social determinants. And so as part of that, we've really seen that bridging the gap is a way to help us supplement and add to the great efforts that we've had underway in diabetes care.
With patients who have diabetes, some of the huge barriers, of course, are support in the home. Being able to follow through on the diabetic management is sometimes a huge barrier.
Once patients come in for their first visit, our care team greets them and makes sure we understand all of their past medical history and the important medical information to help care for them. And then as part of that visit, we refer them to the community resource desk to understand what other types of needs they might have to optimize their health. The Community Resource Desk is a new, innovative way of connecting our patients to the right partners within their local area to help make sure that they are getting the right resources to optimize their health, whether it's in areas for housing, for food needs, for transportation, whatever the gap is, they're really helping to get that connection, which our clinicians have felt for a long time is needed, but haven't had the way and the connection point to bring that closer.
I supervise 5 community resource desks in 4 different counties. Impact Northwest is a nonprofit organization. We serve Monoma County. Within other counties, we had made connections with other organizations that maybe Impact Northwest, who we work for, doesn't have the resource. We can go with another organization. Like in Washington County, Community Action is the organization that serves this county.
Some of the strengths of our community partners are that they know so much about our local communities, and they are really helping to create the right connections in the local communities.
Patient barriers that we see on a regular basis, especially with a population that is aging, is income and being able to afford seeing a specialist. Having integrated care in the clinic, it's also helped our providers have a place to refer our patients because these patients have such complex needs. The doctors are trying to address their medical needs, but there's all these other things impacting. Since the Community Resource Desk, we've been able to refer the patients to somebody in our own building and to be able to connect the patient to something right when they're here. It just makes it more accessible and more immediate, the care that we can provide.
We are hands-on. We take the time to show the client the resource that they're asking for. We educate the client, we call with them, we show them in the computer if that's what's easier for them. If the person has diabetes, for example, and the reason that they came to us is because they can't afford the food, we make sure that they know this is the best food pantry for you because it has produce, and we explain kind of the food that they have in the procedures. We educate them and we make sure they know and they understand before they leave the desk. I've seen a lot of the clients that I helped in the past, and they're doing good. All they needed was a little push or somebody to pretty much, be there for them.
As a leader, I've had providers from our Bridging the Gap clinics come to me and share with me how important it is to have the Community Resource Desk available to them. They didn't realize until they had the service available how important it is to go beyond just the clinic-by-clinic visits that they can provide to connect their patients with the communities and improve their outcomes long-term.
Providers and staff, they see that the patients are able to get some of those huge social needs addressed so that then they can focus on the patient's medical needs to improve their health outcomes in their lives.
What I'm most proud of is the improvement in outcomes we've seen for our patients with diabetes. As we compare with other national measures that are recognized by clinicians across the country for diabetes care, our patients are now achieving outcomes that are at or above the 75th percentile nationally, meaning that long-term our patients are going to achieve much better quality of life and health outcomes.